Hello everyone, my name is Dr. Amanullah and today we shall discuss temperature regulation in newborn. So, newborn babies are prone to develop hypothermia and they are prone to lose heat because of environment and due to certain factors. Today we shall discuss hypothermia in newborn. Newborn babies are more prone to develop hypothermia, and hypothermia in newborn is considered or is known as when temperature is less than 35 centigrade in the newborn. That condition is known as hypothermia. 35 centigrade, when temperature is less than 35 centigrade, so that is known as hypothermia. And there are four types of temperature loss in newborn. Number one is radiation, number second is conduction, third is convection, and fourth is evaporation. So these are four methods through which a newborn baby or neonate lose heat in the environment. Radiation, when baby is lying on the table, delivery table, and heat is lost from its body through into the environment through radiation. That heat loss is known as radiation. Conduction, when a baby is lying on the table and that heat is lost through conduction is through contact, that is known as conduction heat loss. And convection, when environment is around the baby is hypothermic, then heat loss can occur. And evaporation occurs through evaporation from the baby's body. So these are four methods of heat loss from the body of the baby: through conduction, radiation, convection, and evaporation. So what are risk factors for developing hypothermia in the baby? A baby which is preterm is more prone to develop hypothermia. Our baby developed apneic birth asphyxia or asphyxia at the time of birth in obstructed labor, baby are more prone to develop hypothermia. And intrauterine growth retardation, baby are also prone to develop hypothermia. So these are risk factors for development of the hypothermia. So what will be the clinical features for hypothermia of the baby? Baby will be cold because temperature has been lost. There will be irregular breathing of the baby, and baby will be cyanosed. Color of baby will turn into blue, and there will be scleroderma and DIC. Bleeding will be there in the baby of the hypothermia. So these are clinical findings of hypothermia. What are complications of hypothermia? Complications of hypothermia are patient may baby may become hypoglycemic and start convulsions, and there may be acidosis because lactic acid is accumulated, and there is hypoxia, decreased oxygen, or there may be shock because of hypothermia, or apnea will be there, no respiration, cessation of respiration will be there, or intraventricular hemorrhage can be there, sinus bradycardia will be there because of SA node in hypothermia, decrease conduction velocity, that's why sinus bradycardia will be developed, and neonatal mortality can be there in the baby because of hypothermia. So these are the complications, and the management of hypothermia will be give kangaroo mother care to the baby. Baby should be attached with the belly of mother. Baby should be attached with the belly of mother, and that is known as kangaroo mother care, where it is same like when kangaroo attaches its uh, baby with its belly. So the same human baby is attached with the belly of mother, that is known as kangaroo mother care. So in this way kangaroo mother care prevent hypothermia. And slow rewarming or radiant rewarming is treatment for patient of hypothermia. Kangaroo mother care is more preferred and more uh, useful for prevention of hypothermia of the baby. And environmental temperature can cannot affect the baby which is given kangaroo mother care. So this is hypothermia, and temperature regulation in the newborn. Baby is given kangaroo mother care. As this picture is shown that baby is attached with the belly of mother. It is known as kangaroo mother care like this. In kangaroo mother care, a mother can also breastfeed the baby to prevent hypothermia and hypoglycemia as well. So these are benefits of kangaroo mother care. In next video we shall discuss hyperthermia in newborn or neonate. So this was today's topic, hypothermia in the newborn.